So this is the post-op knee brace that you'll have fit. This is common after ACL reconstruction or meniscus repair, MPFL reconstruction. The most important thing initially is we will set the dials to allow a certain amount of motion. This is the red tab that has a locking button, and so the brace is designed to lock your knee out straight, but when it unlocks, it'll allow it to bend to the degree of flexion that we set. And so it allows you to safely move once you unlock both sides, but that brace is stopping you at 60 degrees of flexion. So the brace will typically be set from 0 to 90, and that allows you to only bend to 90 degrees so that you know you're not doing too much flexion or bending of the knee before your knee is ready. So a couple of things, just getting oriented with the brace itself. We'll go ahead and make sure that the bigger side is up towards the thigh, and then the wheels. So you want to locate your kneecap right here. It's helpful if you have someone that can hold the wheels, typically the patient for you, and then get some help. So you want the wheels in line with the kneecap. So her kneecap is right here. This is where the wheels go. So initially we're going to start by undoing this side, and this Velcro allows the brace to tighten. So we'll tighten that, lock that there, lock this, and now you can tighten it from here. So these are meant to fit all sizes, so a lot of the times the Velcro is going to be either too short and end here on the plastic, or too long. If it's too long or too short, you can adjust it by taking the tab off, and then you can fold it over, or you can cut it, and then it'll fit as needed. So I would recommend folding it, at least initially. You're gonna have a lot of bandages, and so the brace is gonna be a lot bigger initially over the bandages, and then over time, as you take off the bandages, you may even lose some muscle in your quad, and you'll have to keep constantly readjusting the brace. So I think the best way to start is the two that are closest to the knee, keeping that there with the brace locked, typically. And then same thing, we'll open this up. We'll get this nice and snug right there. Lock this in. And then you can adjust it from here. And then of course the same thing with as far as the Velcro, taking this off if needed, fold it over, readjust here. And then you do the same thing, bottom and top. This is where you can come over to the wheels. And so it's real important when you're following your post-operative directions, if you're told to walk or sleep at night with the brace locked, what you want to do is make sure that it's in the locked position. A lot of times it's good to go ahead, unlock it, really get it nice and snug, readjust it. The knee is going to want to be bent when it's painful. And so you want to kind of force the knee down into full extension as much as you can tolerate, and then lock it from there.